suppression, layer by layer. Yes, layer by layer suppressions, or according to the layers, whether it is a cure or suppression, we have learned that much. Now, in this, the end of My Assumptions of Miasm. This is the book that we are reading now. Here, we have already read with few pages. So welcome all doctors again to reading of Prafful Vijaykar doctor's book. That is My Assumption of Miasm. That is page number 25 of the first lesson. So we have already dealt with 3 cases from Vijaykar sir's experience, and that was all a coma case where the stupor was alternating with shrieking, and we have dealt with few rubrics in our last class, and we have ruled in and ruled out, or we have discussed about the medicines in the last class. And here Vijaykar sir has employed belladonna and hellebores for 2 or 3 of his cases, and in certain case he got improvement. Some other senior doctor has prescribed and he got full improvement. In the second case, it was a vegetable life, and finally the patient succumbed. And in the third case, there was no improvement at all, and the patient succumbed. So now we want to know the credibility of homeopathy, like why, like when Samuel Hahnemann has given us this similia similibus curanter, this great theory, as well as his organon of medicine, the books. According to the books, when we practice, why is it that we are not getting consistent results? That is the $1,000,000 question now. And there, Vijaykar sir is taking our attention towards the importance of miasms. Now, he is giving us step-by-step learning process. That is that is the next paragraph. We shall straight go into the reading of the book. That is learning from Hahnemann's experience. Like this kind of a stumbling was there for Dr. Samuel Hahnemann also. Then what did he do at that time to make his system perfect? So in the last case, where the patient of hepatic coma came out with belladonna only to lead a vegetable life for 3 months, the very fact that the patient came out of comatose condition means the remedy was similimum to that state of coma. Now, what is this hepatic coma now? What is hepatic encephalopathy? What is hepatic coma? So here actually, when the liver pathology goes beyond a certain limit, when the liver undergoes failure, or when the liver is totally damaged, what happens? The loss of brain function happens, and that is known as hepatic encephalopathy, where there can be symptoms like disorientation, or there can be behavioral changes. There can be forgetfulness, there can be confusion, or there can be shaking of the hands and limbs, or there can be slurred speech, and total disorientation will be there. And finally, it can progress into coma. That is called hepatic coma. So it is actually a biochemistry coma. So here the levels are not or they are all beyond limits, and the one of the organ is not functioning, and this has led the body into coma. So guys, is this reversible or not reversible? Is this reversible or not reversible? Give me some answer from your side. Hepatic coma, hepatic encephalopathy, and what is your experience regarding that? Soumya is rightly saying that it is very much reversible. Exactly. Dr. Arya Devi is saying it is reversible. Dr. Adira is saying it is reversible. It is very much reversible. Once the biochemistry is corrected, it is reversible. So we have got a good scope of bringing. Dr. Brahmavidya is saying that it is reversible. So here what happens after giving the medicine? It is important to bring the patient out of the coma. So here Vijaykar sir has given exactly that after giving belladonna, the patient has come out of coma. But after that, what should we do? Bringing the patient out of the coma is done by belladonna. So it has acted in that stage only. After that, the next stage comes in. That is the primary comes in. So this is the secondary thing. The hepatic encephalopathy is the secondary thing, or it is rather the complication of the primary ailment. The primary ailment was the liver failure, which has to be addressed now after the patient has awakened from the coma. That's what we have not done. So we have not completed the cure here. With belladonna, what happened? Stupor alternating with shrieking. With that rubric, belladonna acted in that stage very beautifully. The patient came out, but then further, the liver was not getting any better. We did not even treat for that. The patient led the vegetable life. or for 3 months, already the liver was under compromise and the patient succumbed. So that's what Vijaykar sir is saying here. Belladonna was similimum to the comatose condition, means the remedy was similimum to that state of coma. That's all. The fact that it removed the comatose condition means probably it corrected the metabolic encephalopathy, yes, or reduced the cerebral edema, which happens even with an intravenous drip of mannitol or steroids. So this generally happens in all the allopathic doctors. They will immediately reduce the cerebral edema and the patient will be brought out of the coma. The cause was, no, sorry, the cause of the metabolic encephalopathy, which in this case was the cirrhosis of liver, was not controlled. And the liver went on getting damaged, disease went on increasing, and the patient died. So this is what has happened here. Only the coma part was taken care of by belladonna, whereas the real disease, the primary disease, was kept untouched. It has to be treated actually. So the next paragraph is homeopaths so often face a similar problem in other cases too. Cases of acute renal failure are treated by good homeopaths with the most well selected similimum. What happens? We all had this experience, right? The patient reports sensation of well being. Yes. For how long? After the best selected similimum, patient improves very well and develops tremendous faith in homeopathy and the homeopath as well. Even the serum creatinine and blood urea nitrogen levels reduce in the first few weeks of the treatment. How many of you have had this experience, doctors? Just give me some indication in the chat box of treating acute renal failure or chronic renal failure, yes, CKD, initially there will be a lot of improvement. You take the case in detail and you give according to the totality of the symptoms. You work out, you analyze, you take the rubrics, and you give up a medicine. Give a medicine. What happens? The patient will tremendously improve. The well-being improves. The mental well-being improves. The general well-being improves, and the sleep and etc. And the patient is going to the for his work, his daily routine, and the serum creatinine levels also come down, blood urea nitrogen comes down. What more we want? And there will be initial gaining of the weight also. Patient will come all smiles from lip to lip. Huh? What happens here? After some time, there comes the edema and the creatinine level goes up. Again, the kidney is showing symptoms of compromise and the BP also increases. This happens, no? So even the serum creatinine and blood urea nitrogen levels reduce in the first few weeks of the treatment. Patients confess that they sleep better, eat better, and even resume their office work or business. But these happy circumstances do not last, and the patient gradually slides down in health. He starts losing weight. His blood pressure goes on gradually increasing. He starts becoming edematous. Serum creatinine and blood urea increases gradually. He starts feeling breathless. All this deterioration, despite the right remedy, is unbelievable for the homeopath, isn't it? He insists that his remedy gave the patient the general sensation of well-being, good appetite, good sleep. What more we want? And hence it was the right sipilimum. Yes. Then why? Why should the patient and his kidney deteriorate? Actually, this is really interesting, no? This is taking us into the depth of the more and more difficult cases. Fibroids of uterus, tumors, benign or malignant in the skull or abdomen, atherosclerosis of coronary arteries or cerebral arteries are peculiar diseases. One finds that patient says, I am much better. I am much better ever since I started your treatment. And yet he deteriorates gradually but surely to make a mockery of the principle of similia similibus curanter. I know you have all underwent all these difficult circumstances. In all the above cases, the million-dollar question is, has the homeopathic principle of similia similibus its own limitations? Should it only be of use in physiologically reversible diseases and fail in more dangerous and terminal disease? But then we have heard of so many incurable cases reversed. We have heard and read of miracles in homeopathy. Why then are the miracle cures so rare? Or are they accidental? In short, what are the reasons for failures of homeopaths? Why do homeopaths who boast of being good interpreters of human mind and having fantastic analytical brain to discover and invent newer and newer remedies, do not know how to cure a case of cancer with sulfur. Yes, again, sometimes we also have this doubt. Why did the initial medicine give the partial improvement then? That is our question. After giving Bugsol for a psoriatic case, the patient here, Bugsol 200 single dose. It was a syphilitic miasm. And the psoriasis was very bad. It was from head to foot, and there were cracks all over, and there were redness all over. And it was a typical syphilitic thing. And even the joints were affected. Psoriatic arthritis. Merxol was given after the analysis of the case. The patient started improving. Just like that, magically the patient started improving. But then we say that is also not a good sign, right? The improvement went on and on and on for 99% improvement. And we can't even believe like what is happening to the patient after that. Suddenly, some kind of a psoriasis thing appeared, a kind of a rash appeared. Rash appeared on the face, and this rash developed on her bends of the joints in the elbows, in the popliteal fossa, everywhere it started affecting. And I said that, okay, all these things are good signs. These are only psoric pattern. But then I knew that somewhere this is going wrong because it was kind of a psorosyphilitic thing. And the patient could not bear it at all. And it was the cool winter of December end and January here. This happened some 5, 6 years back. And still the patient is under my treatment and she is getting a lot better now. She is, of course, the the recurrence is a lot better, or the relapses are not there now. So what happened in homeopathy or in psoriatic disease, we generally get that kind of a relapse and remissions. No, now that period is getting better and better, and the patient is able to go to the office and all that. But my narration was after giving Merxol, why did it cure 99%? Only to come back. All the eruptions came back from head to toe. Again, it was a real bombarding of the eruptions and the cracks and the joints. The patient was not able to walk, etc., etc. Of course, we had to take the help of steroids also at that time to bring the patient out of the ailment, out of the really sickening disease. And it was her marriage also. She has to be presented in the marriage. At least she has to stand on the stage. The joints were so bad. So why did this happen then? If Bergsol did not work, then it should not work. Then why did it work initially for the 1 month? In that 1 month, everything was gone completely. So then we have a doubt about the similia similibus curanter. So Merxol was similimum to that case. Otherwise, how can that improvement come? The joints improved and the cracks improved, and according to Herring's law, it all improved, and the psoric eruption started, which immediately turned out to be a syphilitic variety, and then comes ABCD, all the symptoms in a cascade, and it simply struck us down. So, what is homeopathy then? What is similia similibus curanter then? The answer for all the above questions is in one of the aphorism by Dr. Hanuman, aphorism 205. It states, homeopathic physician never treats one of these primary symptoms of chronic miasms, nor yet one of their secondary affections that result from their further development by local remedies. But he cures in cases where the one or the other appears only the greater miasm on which they depend, whereupon its primary as also its secondary symptoms disappear spontaneously. I bet nobody understood this. Yeah, everybody will be talayatifying, everybody will be nodding their head. It is very difficult to understand the aphorisms, and that is the reason of all these confusions in homeopathy. So he only means that the primary disease is there, and then the complication of the disease is there. The complication is nothing but the secondary disease. So when we treat the primary disease, automatically the secondary diseases should not be there. That is in the first place when the patient comes with the primary. The patient is already coming with the secondary, which means the patient is already coming with the complications. You treat the complications and it immediately takes care of the primary symptoms as well beautifully. So this is how it should be. I shall give you an example. I had a diabetic case, a patient, a respectable lady of senior citizen lady, more than 60 years she will be. And her presentation on diabetes was of a complication, that is the secondary symptoms were there. Diabetic neuropathy was there, and there was tingling and numbness all over the extremities, and she could not sleep, etc. What had happened here? I took the case and I had given her a dose of arsenic album 200. She was a very neatly dressed person and all. You all know how good a typical arsenic she was. What happened? Initially, the next month when she came, she said that I'm sad. What happened? The value of the sugar is more now. So how much is the value? It has crossed 300 and 400 PP and fasting. Okay. So I asked, what about your secondary symptoms? That is, what about the complications? How is the diabetic neuropathy? How is the numbness, the tingling, the cardboard sensation, etc., the burning of the limbs, etc.? She said, oh, I have forgotten about that. All those things are not there now. So this is how it is. When you had given the remedy, the right remedy, it takes care of the complications first. The secondary symptoms will be taken care of first. Then energy can neither be created nor destroyed, but it can only be transferred from one form to another. So what had happened here? The diabetes is which layer? Diabetes mellitus is which layer? Layer 5. And the neuropathy is which layer? Layer 6. That is the peripheral nerves
Sixth
are
layer.
affected. Yes, Shubhangi? Yes. So what had happened here? After giving the medicine, yes, Dr. Kalviri, the disease has traveled. The disease cannot disappear into thin air. It has to travel layer wise, layer wise. Either it can go from the sixth layer to the seventh layer, which will be, is it a suppression or a cure? Sixth layer to seventh layer, sixth layer to seventh layer, is it suppression or cure? It is suppression, of course. So here what had happened, from the sixth layer, it has come into the fifth layer. That is, the neuropathy is gone and the diabetes, the insulin or whatever, the resistance was high and the glucose level was on the higher side. Already the patient is correct, Atira. Here it is a cure. Already the patient is having hyperglycemia, and that energy from the sixth layer also came back with force, with lesser force. To climb down the ladder, it is much easier with the energy levels, with the increased energy levels of the patient and with the generals improving, the value of the glucose alone increased. So now, is this a good sign or a bad sign? It is a good sign. So what should I do? When there is the improvement happening, I am not giving arsenic album just like allopathic tablets like daily one dose, etc. A single dose has been given. Why is the single dose given? It is intended that this single dose should go and correct her genes. So it is acting in the genome, in the genetic code. The body will know which layer the disease is and what has to be cured. The body will first try to protect the parts, and that is the reason why the secondary symptoms are getting better first, getting better in the when the medicines are administered. And so the patient's sugar values like what should I do? Already the stimulation of the vital force has happened. Vital force is autonomous. It knows, it is intelligent how to take care of the body, how to take care of the diseases, how to bring about the health, how to maintain the homeostasis. Our medicines need not teach that to the vital force. The vital force is stimulated and it has already started acting. So I kept off my hands. I did not give anything but PL. What happened? Yes, Adira. I waited with the PL. In the next month, in the subsequent months, the fasting blood sugar started reducing and the PP blood sugar started reducing, and the patient came out beautifully. How many doses of Arsal did I give? 200 single dose I had given long back. And even now, the patient is continuing with the 3 months remedy, 3 months, 3 months. I have been sending her the medicines. Old lady, just she wants to have the support of the medicine, that's all. But then no complaints so far. And every time the doctor will send me the values. It will be 130 fasting sugar, 180 PP sugar, around that. So this is what is given in aphorism 205. There will be primary symptoms and there will be secondary symptoms. Now you are all thorough with what is primary and secondary symptom, right? Yes, thank you, Arya. And he further writes, our master further writes, that the primary symptoms are destroyed by the allopathic physician. Yes. When the patient is having a diabetes, the patient will go to the doctor and patient will give what? Anti-glycemic drugs like metformin, gliptin tablets and all they will give, and what will happen? Immediately the sugar levels are under control. But what will happen? The disease progresses and it will go and affect the blood capillaries and it will give varied symptoms like neuropathy, nephropathy and retinopathy. That means it will go into the next higher stage and that is suppression. It will climb up the ladder. The hypertension, which was the cause of renal failure, was suppressed by allopathic suppressants, thereby removing the primary reaction of the organism and worsening the secondary reaction, that of destruction of the kidneys. Already, the patient is having hypertension, so that is the primary. This primary can be very effectively tackled in our allopathic counterpart. What happens? Simply give them an antihypertensive. Just analyze the patient and give them some beta block or calcium channel blockers, etc. And what happens? The hypertension is under control. But what happens when the hypertension, when the BP is rather controlled, the other parts, whichever is vulnerable to this patient, whichever is the according to the susceptibility of this patient or according to the organ affinity of this person, it will go and affect certain parts. Here it is the kidney. So that is the secondary symptom now. The secondary reaction, that of destruction of the kidneys. Let us see what happens. Are you all with me, guys? Just give me some raising of the hand or something. Yes? Yeah. Let's see what happens at the physiopathological level. The narrowing of the renal artery causes reduced blood supply to the kidneys. When the hypertension is controlled, thank you, doctors. When the hypertension is controlled, the body is raising the BP in order to ensure that blood through the blood the nutrition is reaching every cell of the body, the every extremity of the body, every end organs like the liver, like the lungs, like the heart, and like the kidneys. All the end organs are receiving enough blood, oxygen, and nutrition. For that purpose only, the BP is increasing. When the BP increases, what happens? The blood vessels also will be dilated and the heart will be pumping with more force, and it makes sure that the blood and the nutrition reaches all these organs. Narrowing of the renal artery causes reduced blood supply to the kidneys. When the hypertension is there, what our allopathic counterpart do, or what sometimes we also do, somehow the BP will be kept under control. When the body is not allowed to supply the blood to the different parts of the body, what happens? The end organs will start failing. Narrowing of the renal artery, that causes reduced blood supply to the kidneys. The kidneys, which are now starving from less nutrients because of less blood supply, in turn ask for more. When the kidneys are asking for more and more nutrients, what happens? In response, the organism as a whole reacts by feedback mechanism and orders the heart to pump blood with greater pressure into the narrowed arteries so that optimum blood supply to the end organs is maintained. Again, the kidney is telling, or the kidney is yelling out, come on, look at me. My artery is reduced. The renal artery is reduced. It is narrowed in size, and I am not getting enough food or nutrients. Then the body will, the autocracy, no? So our vital force will understand the problem and it will order the heart. Heart is the pumping organ. Heart has to pump harder and make sure that the blood reaches the end organ, that is the kidney here. Again, what will happen? Again, a stronger antihypertensive will be given. Yes, starting with there will be only one tablet. Then again, additional 2 or 3 tablets will come after a long time. No, after some 5 to 6 years the patient will be all good with that one tablet for 5 to 6 years as long as his psychosis uh, supports him. After a certain time, what happens? This one tablet is not enough. Then one more or two more or three more additional tablets are all given. And what happens? Somehow the physicians make sure that the kidney is failing. It has to fail because they will not allow the renal artery to dilate, or they will not allow the hypertension to occur. When the hypertension occurs, sometimes it can go to 200 bar 120, etc., which means the heart has to pump that hard to ensure that the blood and the nutrients reach the end organ or to dilate the renal artery. But the allopathic physician, as also the ill-informed homeopath, it is not a blame against the allopath. It is for us also to learn. The ill-informed homeopath tries to reduce the hypertension with local remedies, which are called antihypertensives. The very idea of the organism to defend its end organ by increasing the pressure now stands defeated. Ultimately, what will happen? The end organ will fail. The kidneys now receive less than optimum blood supply and hence less nutrition. Thus, it starts getting degraded. The kidney parenchyma gets destroyed not because of hypertension, but because of lowering of blood pressure and the patient is now ready for dialysis. Are you all with me? Now the poor kidney, it is unable, in spite of all the yelling and crying, it did not get enough blood supply, enough nutrition. So it fails finally. And now we are planning the patient to put under dialysis because the functions of the kidneys are not happening. The urea is not excreted, creatinine is not excreted, and in the blood, the serum creatinine and that BUN values are all going high. So artificially, they have to be removed from the blood, and that is why the arteriovenous fistula will be created, and dialysis happens through the help of the machine. Thus, the primary cause of atherosclerosis of blood vessels caused by psychosis miasm goes untreated, the disease progresses, and the patient dies. So this is the primary disease and the secondary disease. Now we go to what Samuel Hahnemann has been saying us. In aphorism 205, he further adds, the homeopathic physician finds that primary symptoms have already been destroyed. BP patient normally gets low, yes, Sai Narendra. BP patient normally gets low EGFR generally, yes, and the microalbuminuria. So you have to check here for the early detection of kidneys. You have to look into the microalbuminuria because at that level the kidney functions, the serum creatinine and the urea levels will be very normal, and you make them do a scan and the CKD will be normal. Yes, the CMD, the corticomedullary differentiation will be normal, and the patient will think that, okay, I'm all good, my kidneys are good. But then through the GFR, glomerular filtration rate, you will be able to detect it early whether his kidneys are under good functioning or not. And microalbuminuria also will help you. So,
Ma'am, in
yes.
similarly in hypertension case, it was around 170, 180, ma'am. So EGFR was very low. So then I gave the medicine. So now BP is around 145, 150, ma'am. And now EGFR, it became normal, ma'am. And urea creatinine also, it's normal. But slightly uric acid is elevated. Is it a right
Not
direction?
a problem. It is in the right direction. It is very much in the right direction. Hats off to you, Sai Narendra. You can present this case also once, no? It will be good learning for all of us. Thank you so much.
Yes, thank you.
So the homeopathic physician finds that primary symptoms have already been destroyed. When the patient is coming with BP, the BP is already destroyed or the BP is already kept under control. And he has to now deal with the secondary ones. The patient will come with bad values of the kidneys that you have to deal with, secondary ones. And that is affections resulting from the breaking forth and development of these inherent miasms, but especially with the chronic diseases evolved from the internal sora. So, you know, Sora is the mother miasm, and from there comes the psychosis and the syphilitic. So, already the soric defense is gone, and the psychosis defense settles in, that is the atherosclerosis and hence the hypertension. This has been compromised, and now the patient goes into the destructive miasm, that is the syphilis, and that only cuts off the blood supply to the end organs and causing the end organ failure. Here, he refers the reader to the theory of chronic diseases. Thus, he makes it amply clear that any chronic or terminal or grave disease cannot be treated without the underlying miasm being taken into consideration. So, what miasm will you take here? When it is a terminal or grave disease, you have to always go for the hunt for the syphilitic rubrics. Psychosyphilitic, or rather syphilitic, yes, Arya. You have to get a syphilitic symptom, a strong syphilitic symptom. Only and only then you will be able to crack it. And sky is the limit of homeopathy. As Sai Narendra rightly said, the GFR came back to normal, the urea creatinine normal, and temporarily the uric acid going high is only a hyperpsychosis. Hats off to you, Sai Narendra, again. Very happy to see the results. And eventually, the BP also reduces. We don't have to give a separate medicine for BP to reduce, right? Which means the body's need is satisfied. When he uses the word homeopathicity, he means it is not only symptom similarity, it is not only symptom similarity or a core similarity or disease similarity. He means that the simillimum should include even the miasm concerned. Hahnemann just said that the homeopathicity should be looked into. This homeopathicity, we all know, we will take the case and we will give the symptom similarity. That alone is not enough. Even the miasm, that means the degree of the disease, also has to be given weightage. In the first case of coma, where the lady was cured by Helleborus, the primary sora, which was responsible for high fever and acute diarrhea, that is the inflammatory stage of intestine, was transferred to the meninges, giving rise to meningism, and later on cloudy sensorium as the disease progressed to what we called as sensorium commune. So this is nothing, dears. Soric coma, that was. The first case was soric coma. What is that? After the high fever or after the acute diarrhea, or rather the fever was suppressed or the diarrhea was suppressed. So it has transferred from layer 2 to the meninges layer. That means to the CNS. That is causing what? Coma or the temporary stupor. So after giving Helleborus was exactly the right remedy for that situation. It brought back the patient and there is no complications further. Why? Because it is of the soric miasm. So therefore nothing else to treat there. This is a purely soric derangement of the cerebral functions and of the whole nervous system. There was no destruction whatsoever. There is no syphilis in any of the parenchyma of the organs. So Helleborus gave the complete cure. Are you all clear with me? Are you all there with me? So this is the reason why Helleborus had given or the coma has been completely reversed in the first case. Whereas the coma with the same symptom was not completely cured in the second case and in the third case. In the first case, it was a soric case. That is the reason why it gave us complete cure. Now we know the similia similibus curanter stands good. It holds good even now. Uh, but in the psoric cases, just by looking into the symptoms or the collection of the symptomatology and giving the simillimum gives cure. It gives complete cure because of the psoric nature. It is totally reversible. Whereas if it is a psychotic thing or a syphilitic disease, the same symptoms, stupor alternating with the shrieking, that doesn't give a complete cure, or it will be partially curing the patient, or it will not even act only. Helleborus was thus not only covering the symptoms, but also the underlying miasm. So two things we have to take care. Symptom similarity we have to take care anyway, but the miasm also we have to give importance. Therefore, she responded well with Helleborus and she got completely reversed. The coma was completely reversed. The second case of coma was having the same symptoms. Yes, symptom similarity. But the underlying cause was a malignant astrocytoma. Yes. Now, what is this astrocytoma? We don't want to simply read and finish the book. Hmm? What is astrocytoma? Astro means what? Star shape. No? There are star-shaped cells in the brain. They are the glial cells. These glial cells are to support and protect. Yes, for support and for protection, the glial cells are there. So there has been a cell multiplication there, and eventually an astrocytoma happened in the brain. Astrocytoma can be benign or malignant. Here it was a malignant astrocytoma. There can be gradations also for astrocytoma. See, there is like oligodendroglioma and all that. No, so certain things are highly malignant, and certain things are little slow growing tumors. So here it was a malignant astrocytoma, and that was the reason for the coma. So here, this required a remedy which had a power to produce growth. Yes, stupor alternating with shrieking is the symptom. And when we select the medicine should be, the sphere of action of the medicine should be, or rather in the provings, this medicine should have been able to bring about growths or tumors. This means I required a sauropsychotic remedy. Belladonna does not have the power to produce astrocytoma and hence cannot cure astrocytoma. Is it clear? Nor does Helleborus have this capacity. See, when you search for brain tumors, there is belladonna also in our repertory. But then, just like that, no, like astrocytoma is considered as it is a malignant thing, it is a growing tumor. All these growing tumors, belladonna is not the right remedy, or belladonna is not what to say, it is not the exact replica for that. There are better remedies. There are better remedies than belladonna. Maybe belladonna produces the growth, that's all. But then a malignant growth or a malignant tumor or a fast growing and all cannot be for belladonna. And it cannot be for Helleborus also. There are other remedies in the rubrics like cuprum, aurum, zinc could have been indicated. But here I did not use my judgment, as Hanuman mentions in Aphorism 177 well. So this is what it is. The repertory is there, the rubrics is there, and in the rubrics, these particular medicines are there. All is not well here. You have to use your reason gifted mind. You have to use your judgment. Belladonna is there, okay, I gave belladonna. And you can even fight, no? Yeah, I took the rubric and belladonna was there. Okay, but then you have to use your judgment whether belladonna is capable of curing this particular condition. Like stupor alternating with streaking, belladonna is one of the best remedies ever. Even for coma, belladonna is the best remedy. But what is the reason? It is not a psoric reason. Syphilis is there here. So in order to cover that sphere of action or in order to cover that growing tumor, and that is the reason for the stupor, you have to select the medicine accordingly. A much more deep acting remedy is needed. Belladonna can be sometimes very superficial. I did not use the symptoms well to prescribe and stuck to homeopathicity. The miasm or cause of the disease was not covered, and hence it was not homeopathic similimum. It so happens that mothers with their precious children visit our clinic again and again for the same old bronchitis, wheezing, and fever, relapsing at the slightest indiscretion in food or change of climate. We take the mentals, physicals, and the generals into consideration and relieve the child to give a result much faster and quicker than the contemporary medicines. So, what is this miasm now? Bronchitis, wheezing, fever relapsing again and again. What miasm and what layer? Bronchitis, wheezing, and all. What miasm? What miasm is it? Recurrent fever, thoropsychotic or rather soric. Yes. So here, maybe psychotic. Yes, it is all soric only. Recurrent fever, recurrent bronchitis, recurrent wheezing, fever relapsing again and again. Children will be brought into the clinic. Yes, Sufaira, soric. And we give the medicine, and what will happen? Immediately the patient will respond. Again, the patient will come back. Again, the patient will come back. The mother happily comes to us because of one advantage. My child does not become cranky or lose appetite when on your treatment, as it happens with the antibiotics, is her contention. When antibiotics is given, the child will be very tired and it will refuse food. Whereas with homeopathy, the child is all energized and the generals or the appetite is all good and the child grows. But then, is it the right remedy? It was not the right remedy. With the Sora, the patient will improve, and the vital force is not strengthened. Again and again, the relapse happens. This is what makes her stick to us. But she says, can't you eliminate my child's problem permanently and comprehensively? Instead, we go on prescribing the patient goes on getting relief, he goes on relapsing, and we go on changing remedies and go on giving excuses or rather blame the patient for not maintaining dietetic restrictions or other precautions. But the result is the patient is stuck to you for years. This is not only in case of bronchitis, same vicious cycle or chain of events are seen in patients with arthritis or with migraines, with cases of mental depressions or any other chronic ailments. This happens. This leads us naturally to think, is homeopathy an insufficient or or an incomplete science? Why is this patient coming back again and again? When will the cure happen? And why did that initial remedy act? When that is acting, we know that okay, it has acted and the patient is all good and the what to say the generals are all good and the patient is all happy. Again and again, why is the migraine headache coming back? Why is it coming back again and again? Or why is the arthritis coming back again and again? Is homeopathy insufficient to cure all this? Or will it ever give a complete cure? Are the limitations of homeopathy the same as its counterpart, that is allopathy? Is it only meant to cure simple illnesses? Do the diseases like arthritis, migraines, hypertension, diabetes, behavioral problems, depressions, cancers, psoriasis, etc., still belong to the list of incurables as an allopathic treatment? 200 years back, Hanuman faced an identical problem. He had discovered homeopathy. Homeopathy was his baby. The credibility of his discovery was at stake. So, this is it, doctors. We have reached a point where we have given the medicine, and again the complaint is relapsing back, and we are tired now. What to do? How much time? How much we will take the retake of the case and give the change the remedy, etc. So we will read the next paragraph also. No, we will go ahead. Yes. Today is any doctor presenting the case? Atira? Anybody is presenting the case or any? Yes. Okay. So for 5-10 minutes we shall read. Hahnemann's dilemma, that is 1816 to 1828. Yeah. Or rather, we will read this in the next class. Okay. We shall go ahead straight to the. Any doubts till now?
Dr. Nooha is presenting today.
Very good. Welcome, Dr. Nooha.
Madam,
Where are you? Yes, Sai Narendra.
Madam, in cases like global developmental delay with autistic traits, with the cryptogenic syndrome, what we have to probe in the mother history, ma'am? Where should we
Come again.
get from the mother side or from the father side?
Come again, Sai Narendra. Global developmental delay is there. Autistic behavior is there.
With the autistic
What else?
traits,
Cryptogenic something you said.
cryptogenic West syndrome. Cryptogenic West syndrome.
What is this? Cryptogenic West syndrome. What is that syndrome? Is there any input regarding that? Okay. So whatever it is, when there is a global developmental delay, yes, here you have to take the mother's history in the first few months, in the first 3 months. What is is there any identity issue? Is there any conflict with her husband? Even before the conception, after marriage, what are the negative underwent by the mother? Was she even prepared to be any understanding issues between the husband? All this, the X will be given by one of the gametes will be given by one parent and the other, no? X or XY. So at that time itself, at the genetic combination itself, at the formation of the zygote itself, there was some problem. So some genetic issue is there, no? And global developmental delay is there. Yes. So definitely there will be some identity conflicts for the mother. You can probe mother in detail in the first 3 months or even before conception. You have to ask immediately after pregnancy, what all did the mother undergo? That is the reason why a healthy baby was not born. Maybe the healthy relationship will not be there between the husband and wife. Okay. And you can go through that particular syndrome, and according in the syndrome, so many things will be given, no? Like so many abnormalities will be given. You can pick up every abnormality and write down there. Like what does this abnormality be? Like, is there any flattening of the foot or etc. etc. No, any which are the organs affected there? The skeletal system or what all, and accordingly you can frame questions and ask the mother, did you affect anything like this in during the pregnancy in the initial stage or even before the marriage? Did you affect anything like this? What was the message that you had given to the baby when the baby was there in the womb? And you can take development arrested, generalities development arrested. You have to go, like you have to like if it is a mental development arrest or a general development arrest. Two things are there. In the mind also development arrested is there. In the general also development arrested is there. If the mind is also affected, you have to take from the mind itself. If it is only the body, then you can take from the generals.
They did
clear?
genetic. Yes, ma'am. They did genetic test also, ma'am. In that ATP6V1A, so many processes are there, ma'am. That also got normal, it seems, ma'am. But she's having infantile spasm recurrently. When she come to clinic also, she was simply raising the hands. Both hands she will raise and she will get startled for a second, and then she will become normal. So
Is it
today I
absence?
am going to take the whole history, ma'am.
Yes,
Ma'am?
mother's history you have to take thoroughly. So is this startling and all? Is it absences? Is it kind of an epileptic seizure, a partial seizure? That also you
Yes,
have to
ma'am.
rule out because all this global developmental delay and all this kind of syndromes can get can get seizures also, where the genetic thing is affected. Always the seizures can be part of that. You have to rule
Yes,
out
ma'am.
that also. Yes.
Thank you, ma'am.
Wish you all the best. Do well.
Thank you, ma'am. Thank you.
Now we are ready, Dr. Nooha.
Yes, ma'am.
Yes. I'll go into mute.
Thank you. Can I start? This is a known case of renal calculi. A 53-year-old male patient came to my OP accompanied by his wife. So he told me that I'm having a kidney stone since 2 years. And he told me that okay, it was diagnosed by an allopath and he has suggested for an surgery, but he don't want to do that. So he went to another homeopath and he was treated by giving a berberis tincture. So the pain was not there, but the stone didn't came out. And he discontinued this treatment since 6 months since there was no pain. Then he came to my OP at or like 12 o'clock, 12 p.m. like that time. And he told me that since today morning I'm having pain on the right side. But it was not that severe. But I know this is that calculating. That's why I came to you. And he hasn't bought any that USG reports and all. So he told me that in that report it was like multiple stones were there and it was in both kidney, but he didn't bought any report. So I was not aware about the size and the number itself. And he's like, I'm avoiding that food, this food, and he gave me a huge list because I'm having this, I'm not eating this, I'm not doing that, I'm not doing that. He gave me like huge list was there. Then he's very timid, secondary extrovert person, and non-diligent, and he's having great degree of anticipation and anxiety. He was asking so many questions, but before when I'm asking anything, before replying, he's looking at his wife, and he needs that her support. Like for everything, he's looking at her. She only is giving something, and his appetite is normal. When I ask about thirst, he's like, since I'm having this pain, I know this is like this, and so I'm drinking so much water. I'm drinking frequently. He's an auto rickshaw driver. So he told me I used to carry water, and frequently I'm drinking since I'm having this complaint. Then he didn't said about any aversion or um, cravings and all. When I'm asking about his diet and all, he's saying, I'm avoiding this, I'm avoiding that because I'm having this complaint. Then his perspiration is profuse and cold. Stool is normal, sleep is normal, and there is no any specific dreams and all. He's very sensitive person to rudeness, criticism, and he is very sensitive. He cannot keep any secrets, and he will share everything with his family, his wife, and children. Before he used to share with his mother also. Now his mother is not there, and he's very fearful person. He's not a courageous one. And his wife told me that before doing everything, he will ask her and his children. Like his children are grown up and they are now they are looking after the home. So everything before doing everything, even if he gets an order, like early morning orders, he will ask his wife, "Should I go?" Like that. He's such a person. On appearance, he's like a bony structure, prominent person, square face and all. He loves to be cared, and when he's sick, he wants that touch and all. He was a religious person before, and used to pray often and visit temples and all. But now he has stopped all that because his children are atheist. So he is not doing that. He don't want to do that. What they are saying, he is doing that. He won't take any decisions alone. He asks his family. And I have probed about the abandoned feeling since this kidney related thing, but I didn't got any. Um, that's all. Any guess about the remedy?
Any guess about the remedy, dears? Alumina, head belongs to other. Beraita, many doctors have come to that rubric only. Head belongs to others. Since he was not making use of his head, right? He always wants that uh,
Yeah, he will ask their
support from his parents, from his wife or etc. Everybody are most of the doctors are telling about Beraita.
um,
Go ahead, no?
but I gave Calcarea carb and Calcarea carb 200 single dose, and the next day the calculate came. I will share the picture.
Yeah.
Mm. Can you see? Can you see the photo? Mm. So then he came after 2 weeks for the follow up, and he bought this. He told me that the next day this came as the stone came.
Very good, no? Dr. Nooha, very good. This is
Thank
actually you have to make note of all these things. And
you.
let me tell you one input here. If the stone is inside the ureter, you need not go into the abandonment conflict and all. When the renal parenchyma as such is affected, you can always think about the abandonment conflict. But then here it is the territory conflict rather, or it is in the inside the ureter only. So somewhere he was getting that irritations and this deposition or this collection is there or this precipitate is there rather. And when you give any medicine, when you give when the stone is inside the ureter, it is little easier to bring it out because it is already in the ureter, it is ready to get evacuated. And the calcarea cup 200 single dose had immediately, the very next day, it has created some sort of a spasm there and it has brought the thing outside because it is a foreign body kind of thing. The body does not need that anymore. So when the indicated remedy was given, the stone immediately, the next day itself, it came out. Really very good effort, Noha. What I thought in your case was,
Uh,
yes. So when you said that we knew that this is a shy, timid, and the guts is not there, or rather an introvert, or rather it cannot make the decisions. And I never thought that this can be head belongs to other. Yes, Shubhangi. I thought that this is a less confident, timid patient. And the moment you said that the patient was having squarish face, what I thought of was a calcarea remedy. And this patient is rather kind of inside his shell. He wants his comfort, or rather, he looks into his wife for all the opinions to be given. And such kind of a patient he is. Rather a timid and low confident patient. That was the only picture which had came to my mind. And when you gave this input, I thought that this is going towards calcarea. But good now, calcarea carb 200 single dose has been given, right?
yes, ma'am. Actually, this wasn't kidney only. Both kidneys.
Mhm. It was not in the ureter.
No, no. When he came for the follow up, he bought that previous USD and new USD also. After the stone came out, he had took another USD, and it was
Then it
clear.
is 100 on 100 marks. It is really 100 on 100 marks for you, Noha. Very good, excellent. And after that, the pain and all disappeared, right?
Yeah, because I have started my practice in October only, and this is my very fresh case, like from
I
October.
know, I know, I know, I know. Yes, yes. This is actually a cherishable moment for you. So
Yeah,
keep all those records properly and wish you all the best now for future many ventures. Hmm?
thank
Good case. Anything else, doctors? Want
Ma'am,
security of family, so not leaving kidney. Yeah.
if the stone is in pelvico-ureteral junction, means what will be the conflict?
If it is in the pelvis of the kidney, right?
Pelvico-ureteral junction.
Pelvico-ureter junction. Yeah. In the PUJ.
Yeah.
That is also in the upper part only. That means right out or right outside the kidney. Right outside the kidney. Again, no, like kidney means what? The parenchyma means it is the real fish out of water problem will be there. Some foreign body kind of thing, some irritation. This is kind of psoric only. The precipitation and physiologically the calcium oxalate crystals or the urate crystals, etc., will be lodged there. Proper evacuation is not happening. Something will be there which is collecting inside the patient's mind. Something regarding the family or something regarding the what to say, mm, maybe the property also. Generally, we say that all these stones are considered as treasures. So something maybe at his workplace or for the house construction, uh, wherever he wanted a little bit of money or something, or maybe some debt will be going on. Some that kind of a money issue also will be going on. Then automatically the body will not let go of the things. It will rather keep all those things and it will be keeping the treasures. It will be going into the storage mode and then it will be getting collected here and there. In the PUJ, it is getting collected. The pathway is narrow there. That is why it is getting collected there. So if any other doctors have any input, please welcome. When you
Even
give the,
isolated feeding also can precipitate this.
if there is, yeah, if it is causing any enlargement of the kidney, like if it is hydroureteronephrosis is there, then
Yeah,
you
it
can
is
think about
causing.
isolation.
Yeah, it is
Yeah.
causing hydronephrosis, left side kidney only. So
Then you
hydronephrosis.
can ask about isolation conflict also, because the body is keeping that so much and the patient is unable to do anything. Kind of a helplessness is there. The body has already produced that treasure or that precipitate and it is not able to evacuate it out. It is getting collected there. And the functioning of the kidney also, no? Kidney is producing the urine, but it is not finding a way out. That is the reason why the kidney is getting swollen up. So definitely there can be isolation conflict there, abandonment conflict. That also you can probe there. That is fully reversible. It is kind of psychotic only. There is nothing syphilitic there. Once the stone is come out, automatically the size of the kidney will come to the normal thing. See, that is what we talked about the primary and the secondary symptoms.
Okay, ma'am. Thank you. And one more doubt.
Yes.
If in case of diabetes, the diabetes values is there for a long years, and then it is causing hypertension also, and then it is causing the heart muscles, and the hypertrophy is occurring means, then how can we probe in such a case? It's a chronic case, but the organ affected
Diabetes.
is heart.
Yes. Diabetes, it starts in the fifth layer and it starts as a psoric diabetes and then slowly the miasm changes. When the miasm changes, again, new symptoms can come in the lower layer also in the new miasm. Syphilitic miasm also can develop in the lower areas. That is progression of the disease only. The vital force is affected, the person as a whole is affected, and then new and new symptoms, new and new end organs are getting affected. Like the heart, the hypertrophy of the heart happens, the BP increases. The first thing is the diabetes. So from that time onwards, you have to look into the journey of the disease. That's how you have to complete the case. Just look into the journey of the disease. And now what is the presenting complaint? Everywhere you have to write down the layer and the miasm. So the disease is progressing. First it was only diabetes and now it has come into hypertrophy of the heart and there is hypertension. So everywhere, what was the stress that the patient had and what is the miasm, how the disease is progressing on and on. And then you have to give the GCS only here. Okay. And Suhaira was asking me some question about the polycystic kidneys. Yeah. So this polycyst means what? It's only cystic things. All these cystic things are for protection. So the patient is having lot of fears and so the cystic collection is there for protection. So you can think in that angle and it is psychosis. Polycystic ovarian disease Just like that, polycystic kidney also. So identity issues. But then when the ovaries are affected, you can always talk about the identity issues. In the kidneys, you can think about the family, about the isolation, and about the abandonment, and about the support. Where does he feel that injury kind of thing? Where does he need that protection, existence level? Yes. When the polycystic kidneys are simply solitary cyst is there, or when the cyst is kind of psychotic, it is remaining there without any growth, don't worry. But if it is growing on and new cysts are coming up, then it is definitely the existence. PCOS, is it fear? In PCOS, generally it is identity issues only. Fear can be regarding the identity again, Kyle, like how will regarding the job, fear regarding the job, fear regarding the marriage, fear regarding how will I present into the world. About her own identity, there can be fears. And cyst is for protection. So you can always ask what is the injury or what is inimical to you. Rubric one is identity regarding rubrics. Confusion of identity. That is one big rubric for PCOS. One important rubric for PCOS rather. And then what is coming up in the case? Like, do you feel neglected, or some delusion rubric will be there. If it is deep rooted, like if the hirsutism and all is there, if it is a complicated PCOD, in PCOD, there will not be much complicated. It will be towards the thorough psychotic only. But then if it is psychosyphilitic, which is PCOS, it is a syndrome where there will be acanthosis nigricans and there will be acne rosacea and there will be putting on weight, that is obesity will be there, and hair fall, that is androgenic hair fall will be there. So it is utter loss of identity. So definitely identity issues will be there, and lot of fears can be there according about her own identity. So you have to probe deep in the identity conflicts only. Then you will be getting from her story. Every story will be different. No. So in her story, you will get lot of inputs and you can convert that into rubrics that will help you to narrow down the medicine. Okay. Okay, guys. So let us call it a day. Bye, dears. Thank you so much
Yeah,
for
thank
being
you.
here. So let us again
Okay,
meet next
ma'am. Thank you.
Thursday. Thank you so much. Bye. Take care. Do well. Okay.